Okay, good morning, everybody. My name is Sheila Dorsey Vinton. I'm the director of the Asian Community Cultural Center, and I'd like to welcome you to our breakout session today with Nicole Roseberry, who's speaking on improving outcomes by moving the prevention lens from equality to equity. Nicole is the Assistant Vice President of Early Childhood Mental Health at Nebraska Children and Families Foundation. Welcome, Nicole, and thanks for talking with us today.
Thanks, Sheila. I'm so glad to be here. Well, thank you all for joining today. I'm very excited to talk with all of you about equality and equity and how we can work on the ground to improve outcomes when we're working in the field of prevention. I also hope that many of the lessons that we've learned working in the world of prevention will be things that help in other communities as well. This presentation really is about practice, so on the ground, community building type strategies. So the first section of the presentation will be working through what definitions of things are, how we construct our work when we talk about collaboration in communities. And then the second half is going to be working together to think through case study examples. So I know that this isn't the ideal format for collaboration here in a webinar structure, but we're going to try really hard to collaborate together to think through some of these case studies and think about how in either prevention or programming within communities, we can improve outcomes by really thinking about equity in a new way. So I'll go ahead and get started here. All right, so the plan. So we're going to first start by talking about the strategic prevention framework. It's okay if the work that you do isn't necessarily prevention. This can be applicable to most work on the ground that we do in communities. And then we'll talk about, just for a few minutes, about equality versus equity. I know that most of you who are coming to this conference probably already have a pretty good grasp on what that is, but I want to make sure that we all come to this presentation and to the work with the same definition. So we'll talk about that for just a few minutes. We'll talk about the class standards in case you're not familiar with them. Then we'll talk about how we integrate a community building framework with the class standards. So how do we put together the way in which we do our work in communities with collaboratives and the class standards, which were really initially meant for health services, and how by working those two things together, we can really think about equity in a different way. And then we'll do these case study examples that I talked about. So I hope that you are ready to participate a little bit, at least in the chat, as we talk through what it looks like on the ground to do this work differently. So the strategic prevention framework. So there are many models of community implementation that exist. Community collaboratives have lots of different ways that they do their work. On the screen, you'll see 3 different community implementation models. And what you'll see if you even just quickly glance across these is that they all have sort of similar components. They might break them down in a little bit of a different way, but it is still a model where you work through these specific steps to get to outcomes, and they all sort of filter through a very similar sort of design. So the one that we're going to talk about today is the strategic prevention framework, not because it's better than any other framework, but because it is the framework that I had used a lot when I was working with community groups on prevention. And I think that it does a really good job of briefly touching on all of the things that are so great about other models as well. So we're going to use it as an example, but know that other models exist and are just as valid as this one. So the strategic prevention framework was created by the Substance Abuse Mental Health Services Administration to facilitate prevention work in communities by community collaboratives. There are 5 steps and 2 overarching guiding principles that are used as part of the SPIF, is what we call it, the Strategic Prevention Framework, so SPIF. Assessment is the first step, so looking at your data and better understanding who is in your community and who you are going to be serving with the programming that you plan to implement within your space. Capacity. So this is person capacity, funding capacity. Do you have the right resources to do the work in the community that you plan to do? Planning. So we know who our audience is. We know who's in our community. We know what resources we have to do that work. So now we have to plan to make sure that we're hitting the right targets. We know what programming we want to do, who we want to affect with the changes that we're going to make in our community. Implementation then of the programming that we chose and that we planned for in the last step. And then evaluation, how did it go? Are we getting the outcomes that we hoped to see? When we think about this in terms of equity, it's did we get the same results with all of the folks in our community? Or is there some disconnect between one group and another when we implemented the programming? Then sustainability. So we know that funding doesn't last forever, and we want to make sure that the things that are working and are working well can be sustained within our communities. And cultural competence. Now, I know that this term at this point is a little bit outdated. At this point, the SPIF model does still use the term cultural competence. So when we're looking at the SPIF model, we'll say cultural competence just because that is the term that's used within this model, but we will shift the wording more toward equity or cultural humility here later in the presentation. So this is what we call the SPIF flower, and it just incorporates the design of all of those elements that we just talked about. And the reason that it's presented in this way is that there's an understanding that community collaboratives, coalitions go through this process, but you can kind of enter the process at any given point. You can sort of jump around. It doesn't necessarily have to be linear or straight across. You can sometimes have capacity to do something, start planning, and realize that you don't actually know which audience would be best for this target that you are planning on. So then you might go back to assessment and look into who is the audience that you should be targeting. It's very funny. So I don't work in my office most of the time. I work remotely. And so my office phone has decided to ring all of a sudden now that I'm presenting. So I apologize for that interruption. Okay. All right, equality versus equity. I know many of you have already heard this either at some point during this conference or within other contexts that you work, but I just want to make sure that we are coming to this program together today with the same language. So again, I won't dig deeply into it, but I just want to make sure that we're all sort of on the same page here. So equality is the state of being equal, especially in status, rights, or opportunities. So a symbolic expression of the fact that two quantities are equal, they are the same. So equity then is the quality of being fair and impartial. So things being the same does not always necessarily mean that those things are fair and impartial. So when we think about equality, we're talking about giving everyone the same treatment. We're providing the same service or opportunity to all people. When we talk about equity, we're talking about similar treatment that brings about equal or fair results. So we really care about the fact that everyone ends up in a fair and impartial place at the end of our treatment condition. So if we're thinking about programming at a community level, we want to make sure that all of the people that are getting our program or are going through our process are getting to the same equal outcome that we intend for all people going through this, which means that we can't always give them the same treatment. We might have to make adaptations or make different decisions about how we go about our programming in order to ensure that everyone gets a fair and impartial outcome. So the boxes baseball game image is pretty ubiquitous. So a lot of people have seen that image when talking about equality versus equity. I really like this image, and it was also featured in the keynote this morning around equality versus equity, because I think that it's easy to see how giving everyone the same treatment condition is not going to provide the same results as we had hoped, right? So if we're in a community and we're planning a parenting program, and we say, okay, everyone gets exactly the same parenting program. What we're going to find is something like this bicycle example, where there are going to be certain people who are part of the target audience that have been tested on that program, who are going to benefit tremendously from getting that program exactly the way that it was created and fielded and tested in the past. And then what we're going to find is that there are going to be a lot of people that are outside of that condition, that the program has never been tested on them. We don't have any research or data to show if it works or if it doesn't work. And they might get some of it. They might be able to, let's see, the man on his bike, he could still make forward movement. He could balance on that bike. It would be uncomfortable. It's not the way he would prefer to ride a bike, but he could still move forward. And he's going to get some of that treatment condition. But then there are other people in this that aren't going to be able to make any movement forward at all. So if we're doing a parenting program and there are people like this young child that are here, metaphorically, there might be parents in your condition who really don't get anything out of what you presented. So we want to make sure that we're collecting the right data, we're making adaptations that are equitable for the group that we are working with. And we'll get a chance to practice that with our case studies. So as I mentioned, the SPIF model calls this element cultural competence. We don't necessarily have to use that phrase, but just because it is part of the model, we'll use it for a little bit here. So what this piece of the model is addressing health inequities via cultural competence within the context of each of the steps of the SPIF. So when we're talking about assessment, are we ensuring that when we collect that initial data, that it's disaggregated, that we know who is in our community and what the needs are of the different groups within our community? Within capacity, are we looking for voices of people with lived experience, or are we making sure that the different community members are represented within our boards in our organization? When we collect data and we do focus groups, are we making sure that we have those voices as part of that process? And so on. So cultural competence should really be infused within each of the steps of the SPIF in order to ensure that we're creating equity and overcoming inequities throughout our entire process of being on the ground and within the context of a collaborative or a coalition who is doing programming in the community. Okay, so why does all of this matter for communities and collaboratives and partnerships and folks who are doing work in communities to help better their communities? So for one, there is a desire to have a greater impact in the community. So we hear from health departments, we hear from community collaboratives, we hear from coalitions that they want to have an impact on all of the folks within their communities, and they want to see a more equitable society. So it's important because it's part of their mission. It's the mission of many of these organizations. And so we want to help figure out a way to do that. So we also hear from those same groups that there's some frustration around not being able to engage with certain subpopulations of the community, that they have a difficult time having these people at their table, hearing their voices. And we want to figure out a way to integrate those folks in a way that's both helpful for the collaborative that is trying to make their community a better place, and for the folks who are part of these populations who might be struggling with the thing that the collaborative is trying to work on, but they don't know how to get engaged, or they don't know how to best meet their needs. And the other piece is actually something that we identified kind of from the outside, which was that many of these collaboratives said that they were addressing health disparities, but then when we asked them how are they addressing health disparities, they would say things like, our events are open to everyone, Our program is available community-wide. We don't discriminate. Anyone is welcome to come to our parenting classes, or anyone is welcome to take part in our events, which, if you'll remember just a couple slides ago, that these fall well within the realm of equality, right? This is open to everyone, and anyone can partake in it at any time. That's a very equality-based argument. What we want is equity. So we want to figure out a way for our events to be open to everyone, but also to be making an impact on the community that is struggling to engage. Okay. So I talked about a little bit of this already on the last slide. And this was articulated very well in the keynote this morning also, that health equity matters a lot. It matters to the health of the people in our community that are part of society. It matters a lot to people's sense of belonging and their ability to participate in their community fully. It matters to the workforce and to the economy. And it's a basic human right? We want everyone to have the opportunity to participate fully and to have the best possible health that they can. And in order to do that, we need to think about the needs specifically of different populations and not just the community as a disaggregated whole. There's a lot to think about when we think about our communities being very different and having different needs across populations. And it can be really overwhelming. It can be a lot to take in and to consider, but it is worth it, right? We want to make sure that everyone feels heard, that have that sense of connection and belonging to their community, because it will improve the health of those individuals, and it will also improve the health of the community as a whole. Culturally and linguistically appropriate services. So many of you may already be familiar with the class standards. I'm not going to go into them super deeply right now because there are a lot of them and we don't have time to dig into them specifically. But I will drop a link in the chat here when I'm done with this section and when we start the pieces at the end where you'll have time to kind of look over things and participate in the case studies. I'll drop a link in the chat to the class standards website so that you can look at those when you have more time. But just very generally, I will go over these really quickly. So the class standards, they are really an overlap between the work to advance health equity, to improve the quality of health services, and to help eliminate health disparities. The Office of Minority Health within the federal government developed the class standards in 2000, and then they were updated in 2010. And we have used them to think more about how within prevention services, we can use them as sort of a stepping stone or a walkway to think more specifically about what it looks like to address health equity in the context of a community collaborative or a prevention program. So there's one principal standard and there are 14 related standards divided into 3 themes. So the principal standard here, as I said, providing effective, equitable, understandable, and respectful quality care and services that are responsive to diverse cultural health beliefs and practices, preferred languages, health literacy, and other communication needs. So that principal standard is really just the sort of overarching umbrella of what we hope to gain by using the class standards. And it incorporates sort of the goals of the other categories within the class standards. And I think that it can be a helpful roadmap as we think about what it looks like to do more equitable work within collaboratives. So the next grouping of the class standards is governance, leadership, and workforce. Again, these just give us a better understanding of what it actually looks like on the ground to include equity. So advancing and sustaining organizational governance and leadership that promotes class and health equity through policy practices and allocated resources. So when we're thinking as a collaborative or an on-the-ground organization about how do we go about infusing equity into the work that we do, These are 3 steps that you could use within governance and leadership to infuse equity into the work that you're doing. The next 2 big groups are communication and language assistance, and engagement, continuous improvement, and accountability. So again, these are actionable items that a group could work on to better infuse equity into the work that they do. Things like ensuring that you have representative leadership, making sure that your data is disaggregated, looking at your policies, practice, and services. Those are all things that are important to consider as we work toward making our organizations more equitable, both to the people who work there and to the people that are served by it. Okay, so we have our SPIF model, which is how we're going to organize our collaboratives work. So all of its work, however that looks. And then we have the class standards, which give us a roadmap for how to integrate equity into our work. The problem is these 2 groups of things are very different. They are different models, but are sort of working toward the same end goal. So how do we put them together? So there is a way to integrate any kind of community collaborative model and the class standards. For us, we put these together for the SPIF specifically, because that is the group that we were working with. So as you can see here, many of the class standards sort of correspond to the steps within the context of the SPIF model. But they don't correspond straight across, right? So the class standards are not broken up into, assessment and data and capacity and resources and that kind of thing. They're in their own structure. So we really have to mix and match across to see where things fit in and how we would want to make sure that we're sort of working through the class process while also working through the SPIF process. So as an example, during the assessment phase, we would want community collaboratives to think about conducting ongoing assessments of the organization's class-related activities, integrating class-related measures into their measurement and quality improvement activities. So that is part of the assessment process already, is doing some of this measurement and some continuous quality improvement. So we would just want to make sure that as an organization, we're starting to think about how equity plays a role in that assessment process and how we can ensure that the class work that we're doing is also being measured, and that when we get back around to the point in the process where we're doing some assessment, that we're also thinking about those measures as part of that assessment. So I am not, again, going to go through each one of these here, but you guys will have access to my slides if you want to come back through this and look at how the class standards can fit into a community organization model. These will be available for you after the conference is over. So you can see here, there's a lot of crosswalking that can be done between the structure of the class standards and the structure of the SPIF model. All right, so using this structure that we have looked at over the course of the first half an hour of the presentation, we're going to do a couple of quick case studies to give you the opportunity to practice integrating equity into a real life example of what it might be like to work with an on the ground organization, and think through the steps that that organization could take to be more equitable and better integrate the class standards into the work that they are doing. So I would love it if you guys would participate with me in this section. So if you would, there are at the bottom of your screen, there's a chat option and a Q&A option. If you have just like general questions about the presentation or things you want clarification on, you can go ahead and drop those in the Q&A. But as we go through the case study example, if you could enter your responses, your thoughts, your ideas about the case studies into the chat. That way everyone will be able to benefit from your ideas and your thoughts prompts that we have. So us as the presenters, we can see the Q&A, but not everybody can. So make sure that you're going to put your responses into the chat so that we can all kind of see what everybody else is saying. So, all right. So the Coalition for a Healthy Community. They are an established collaborative within Nebraska. They are fictional. This is not a real thing. It's a case study example, but we took kind of an amalgam of many organizations that we've worked with over time and created this fictionalized group for the purpose of this case study. So they serve a predominantly white, non-Hispanic urban county in Nebraska, where the largest city is a resettlement area for refugees and has a growing Hispanic population. The focus of the CHC is substance use prevention, and they're addressing that through family management and parenting skills, and they do that through a parenting class curriculum. The CHC has partnered with schools and probation to find families to participate in their programs. They serve anyone who wants to join the program. All of their programs are conducted in English by white, non-Hispanic women once per week at a central location in their city. So their current situation. Anecdotally, they've heard from stakeholders that certain populations within their community are experiencing difficulties. One thing they've heard is that children of refugees are drinking underage and their parents are not sure of how to handle that situation. They've reached out to community leaders to inform them about the parenting programs that already exist, and they have encouraged them to have their families participate. They've also identified community concerns such as poor family management through their needs assessment and are addressing it with this parenting program that they are implementing. All right, so that's the context. So here's the situation that I want to hear from all of you about what you think, what steps the CHC should take to integrate class or to do some work to make their services more equitable. So I'll read it and then please feel free to drop your responses, ideas, and thoughts into the chat. So the CHC wants to educate parents about substances and how to set expectations for their children around substance use. The CHC posts to their social media accounts and sends out flyers to their stakeholders about the upcoming program. The program will be held at the organization's office, which is near the center of town. There's free parking nearby and the space is free for their use. They will provide 3 two-hour sessions on Tuesday evenings beginning at 7 p.m. After learning about new resources, the coalition decides to complete an assessment by reviewing the data they have readily available. Through this process, the CHC notices that none of the data available breaks down populations in a way for them to see if there are disparities among the refugee populations in the community. They do discover, though, that some parents are more permissive than others in allowing young people to use alcohol. They find that in their community, Hispanic youth are more likely to report drinking at home and that their parents will procure alcohol for them. They decide to conduct a series of focus groups, some talking to refugee families and other talking to Hispanic leaders in the community. The data collected in these focus groups show that refugee parents are struggling to adapt to US culture as well as learn the language, while their children are learning quickly and adapting to the customs. In addition, they learned that many Hispanic parents work second shift or are not available in the evenings during the week. All right, what can CHC do to better integrate class and make their services more equitable? All right, they need to train multicultural teachers to train parenting classes, but first they need to meet with parents to find out from the parents what they think the problems are. Maybe they do not think parenting classes will be a benefit. Maybe they don't go to classes at all. Yeah, that's a really great feedback. So one important step forward is training multicultural teachers, but before they even do that, maybe we need to talk to the parents about what the parents think is the right intervention for them. The parents have acknowledged that they're struggling, but maybe parenting classes isn't the intervention that would work best for them. That's great. Yes, thank you, Joanna, offering services in the clientele's primary language. So we know from the history of this program that they've only ever offered these programs in English so far. So we would want to make sure that we have folks who can lead the classes in the primary language, yes. Thank you, Elian, for your help with, we need to change to all panelists and attendees so we can all see the comments. All right. Okay, so Kelly says access such as language, transportation, hours of the classes, location of the classes, meals, childcare. Yes, those are awesome thoughts about access. So one thing that we ran into working with community collaboratives is often they would say that we're going to use the space because it's free, and we're going to use our staff internally to provide the classes because they are free and they're already part of our organization. And sometimes that's the only option. But if you have grant funds, if you have other ways to make it work, there are lots and lots of things that can be done that aren't even that expensive that can really enhance access. Like you said, providing childcare, making sure the hours of the classes meet the needs of the family. Yeah. Yes, Janet, that's a great thing. A location where the participants are comfortable with. It shouldn't just be the most convenient location for the collaborative, right? We're often, I think, tempted to do things where they are convenient or free for our organization, but we sometimes forget that that might not be safe or comfortable for the target audience. Yes, great. Location and time needs to be changed. Interpretation, translation, yes. Offering multiple options for class and learning times, yes, yes. This will come up in the next case study also, that we want to make sure that working parents have the opportunity to attend our classes too, and that not everyone works 8 to 5. Serving meals, I love that suggestion, Jan. Yes, making sure that we're offering what folks need in order to participate in our classes. And sometimes that's a meal, sometimes that's childcare. So back to, I don't know who suggested it earlier, but somebody suggested that we talk to the group first, right? Talk to the parents that we want to have included in this work, and then see what they need. Transportation. Yes, transportation is a really tough nut to crack, isn't it? So I appreciate that you brought that up, because that's definitely part of the access issue as well. Yes, Randy, thank you for bringing that up. So if all of our staff are white women, but we're trying hard to work with a community that is different than that, we should be thinking about that class standard around representation within our own boards, within our own staff, making sure that we have those folks at the table as staff as well. Which also makes it easier and cheaper to have those classes in other languages, or to promote those within those communities if the people on our staff and on our boards are part of that community already. That's lovely. Using community health workers would be helpful in this situation. Yes, Joanna, thank you for bringing that up. Class leaders who are trusted individuals within the community. Yes, so we want to make those connections with folks who are those trusted leaders in our community who can gather buy-in from the folks that we're trying to target. Paying folks for their time. I think sometimes we forget about this as when we do community work, that if I'm the trainer, I'm getting paid to be there. If I am the community organizer, I'm often getting paid to facilitate the event, to make sure that everything is there. And then we expect everyone to take time out of their busy lives to come and be part of our programs. And sometimes that's great. Sometimes it's enough incentive to provide a service that they want to have, and sometimes it's not. So thinking about some kind of incentive structure, paying them, is a really great insight, Kelly. Thanks for bringing that up. Yes, parenting classes do not always resonate with groups. Yeah, thanks, Brenda. I agree. We might need to package things just a little bit differently to make sure that it's resonating with our audience. Okay. Highest priorities, yes, yes. Marketing the benefits of attending, that's a great idea. Oh, Brenda, I love this. Thank you for bringing this up. So the way that we frame the message that we're giving out to parents can be really important. it's not necessarily saying that any one group already has it all figured out and you're the one that just can't seem to get things figured out. We don't want to present a US-centric model. We want to help communities with the problems and difficulties that they've identified for themselves without feeling like we're their savior, right? That we already know all of the answers to what you're struggling with. So here, let us help you. It should really be framed differently. And so I appreciate you bringing that up, Brenda. I don't know if I missed any comments, but if you have any other ideas about this one, please feel free to drop them in the chat. A community advisory board. Yes, absolutely. I think oftentimes, especially in smaller and rural areas in Nebraska, we find that the same people sit on all of the nonprofit boards. So finding a way to create a community advisory board that is more equitable, that invites non-traditional partners, that asks people to come together to advise maybe different sets of projects so that they have a different and wider variety of expertise can be really helpful in creating equity. So thank you for bringing that up, Randy. All right, we're gonna go on to the next case study. Okay, I'll give you just a second to read the cartoon because I forgot that I had another slide here. All right. Okay, so here you guys brought up all or almost all of these already. So I'm not going to read through them all because I think that we hit most of them in the chat, but here are some recommendations for how you can connect the class standards 10, 12, and 4 to your work. So within CHC, we would advise them to kind of think about those specific class standards and then do some of these steps, which many of you have already pointed out. So that's really lovely. All right, I'm going to let you guys read this one on your own because I am going to find that link for you for class standards and drop it in the chat so that you have that. So go ahead and read through this one and then start letting me know what you would do to incorporate class and make this situation more equitable in the chat. Yeah, so thanks for dropping ideas into the chat here as you get finished reading through the situation. So Wendy has a low-hanging fruit suggestion, which is to use a trained interpreter translator. Absolutely. Sometimes I think that we feel like we can get by using Google Translate or having a friend or someone else step in to do translation. But that's not fair to that person that we're asking. It's also not very equitable to expect that a translation is going to be perfect through something like Google Translate. So we want to make sure that the folks that we're targeting get the information that they need to be successful. And the best way to do that would be to use a trained interpreter translator for our materials. Absolutely. Does anyone else have any recommendations or ideas? Yeah, so not expecting one person to speak on behalf of the whole community. I think this happens more than we would like to admit in collaborations and on boards. When there are a limited number of seats, we expect that one person can speak for everyone within a specific group or community. And even if it's not on purpose, I don't think for the most part anybody would really do this on purpose necessarily, but it's something that just sort of happens, and we have to acknowledge that one person's experience is not going to be reflective of all of the needs of a specific community. And even if we can only have one person sit on our board that is within a certain group, we can always still get feedback from other people within that group and make sure that our services are targeting them well and that it is what they need and want from us as a group. Absolutely. Long-term involvement of stakeholders. Yes, so this tokenization, I think that it's very, I don't know, obvious in the way that this situation is described, that this person is being tokenized, but they're really just there to provide feedback on this one specific thing, and they're not a voting member, so they don't actually get to specifically decide what happens next. But I do see this happen a lot, actually, when communities bring groups together where they say, okay, I'd like your feedback on this specific thing that's going on, that we have this idea about how this could happen. And then, okay, well, you're not on a board, so thank you for your advice, and you can go now. And I don't think that, again, anyone does this maliciously, but why can't that person who is interested and wants to help be a long-term stakeholder? Why can't we find a way to incorporate that person's voice in a larger way? And I think that that's really important as community organizations, that we think about giving a voice to people who are interested and want to help and want to continue their involvement, even if it doesn't fit within the structure that we have established. Like, can we find another way to ensure that those people are being heard? Yes, that's lovely. So thinking about how we can make sure that our community and stakeholder involvement is part of our plan from start to finish. The keynote this morning actually talked about this a little bit as well, about when we're gathering community feedback. It shouldn't be just at like the designated time in the process where we said that we would do this, right? So I think sometimes we think that, you know, if we go back to that SPIF model for a second, that, all right, during assessment, we're going to do a focus group with parents, and that's when we're going to hear what parents think. And that is not the best or ideal model of getting feedback from the community, right? Or from stakeholders. That's one piece of that model, and being sure to continue to incorporate that voice through from start to finish on the project can be really impactful. And it can be difficult, right? It might change the direction of your project halfway through. And as someone who has been in the community organization capacity, I know that that is a very hard thing to reckon with. It's hard to think through what it would be like if you get feedback in the middle of your project and you realize that the target audience is saying that this won't work for them. You're already so far down that path. But that's actually why we have these processes. That's why we have those checks, because the worst thing would be to get all the way through that process and have an inequitable outcome for the folks that we're trying to help, that we're trying to make their lives and their health better through our process. So if that's not going to be the outcome that we get from our process, then we need to make sure that we catch it as early as we can. And having a community stakeholder involvement process throughout an entire project is a really great way to do that. All right, I'll give you just one more minute if you have anything else that you want to add to the discussion. And I see that we actually, I think, have enough time to do the third case study, but I hid those slides. So let me unhide those slides really quick here. And then we'll do the final case study. You get to see it. Okay, I guess, but I can't figure out how to unhide that slide. I'm not sure what's going on about that. So we'll go ahead and just go into next steps, and then we can do a little bit longer question and answer session in case you guys have any questions. So, all right, so next steps. So we'll working with community-based organizations to work on moving their work from equality to equity, eliminate health inequities in the communities. No, it will not. But what it will do is start the conversation and start moving in the direction of health equity for all people in all communities, right? So each little step forward is something, it's momentum, it's making those choices every day to create better outcomes for all of the communities that we serve. So we know that this is only one tiny sliver of the pie to making our communities more equitable and to have fewer health disparities, but it is one slice of the pie, and it is an important step as we think about community collaboration and community work, to really move that lens from it's open to everyone to how do we ensure that everyone ends up with the same outcome. The next big step is thinking about social justice. That is not what this presentation is about today, but I think it would be a disservice to not talk about the fact that moving from equality to equity is just the first step on a longer journey for many community organizations, but it is a big step and an important one as we think about what it means to serve our communities and to help everyone be as healthy as they can be. So we know that the next step is social justice. It's thinking about systemic barriers. It's thinking about what it means to be a community-based organization within a larger structure. And there are lots of other great, awesome people and books and talks about systemic work, so I'm not going to get into that today. I really hope that as we start to make this shift toward equity, that people start then thinking about what that means within a larger context of the communities where they live, within the other organizations that they operate with, and how they partner together to ensure equity for all. So at the time that I wrote this chapter, at the time that we were working through creating this presentation, I worked at the state of Nebraska doing prevention work in communities. And now I work at Nebraska Children and Families Foundation, and I do a lot with the early childhood world. And I found this graphic as I was going through and just editing and updating the presentation for this year. And I love it. Working in the early childhood sector, this one really spoke to me. So just another way of illustrating some of those concepts that we've been talking about throughout today and throughout the conference as a whole. But I just really liked this one. It's something that we actually use in some of our early care settings to talk about equality and equity. So I just wanted to put it up here as kind of a final slide to continue to think about what this means for community collaborations and community organizations as they serve the people in their areas. References. So if there's anything in the presentation that you want to know more about or go back to when you get the slides, you can look at the reference section. And any questions that you have for me.